Bedaquiline is used with other medications to treat active multi-drug-resistant tuberculosis, TB, of the lungs in people with limited treatment options. It belongs to a class of drugs known as antibiotics and works by stopping the growth of the bacteria that causes TB. It is important to note that this antibiotic treats only bacterial infections and will not work for viral infections such as the common cold or flu. It is essential to use bedaquiline only when it is needed to avoid causing it to not work for future infections. The daily dosage and optimal timing for taking this medication should be determined by a healthcare professional. Before you start taking bedaquiline, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with food as directed by your doctor. The usual dosage is once daily for the first 2 weeks, followed by 3 times a week for the next 22 weeks. The dosage is based on your medical condition, age, and response to treatment. Children's dosage is also based on weight. The manufacturer directs to swallow the 100 mg tablets whole. If you are using the 20 mg tablets and do not have trouble swallowing tablets, swallow the tablets, whole or split, with water. If you have trouble swallowing tablets, you may take your dose in a different way. Crush the tablets and mix with soft food, or add your dose to water and then mix with a beverage or soft food. For the best effect, take this antibiotic at evenly spaced times. If you are taking this medication daily, take it at the same time each day. If you are taking this medication 3 times a week, take it at least 48 hours apart on the same days of the week at the same time of day. Mark the days on the calendar when you need to take the medication. Continue to take this medication until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early or skipping doses may result in a return of the infection. If your condition lasts or gets worse, make sure to inform your doctor. If you experience nausea, joint pain, or headache while taking bedaquiline tablet, it's important to let your doctor or pharmacist know. It's also important to remember that this medication has been prescribed to you because the benefit is greater than the risk of side effects for you. While many people using this medication do not experience serious side effects, it's still important to be aware of potential symptoms of liver damage, such as nausea or vomiting that doesn't stop, loss of appetite, dark urine, stomach or abdominal pain, or yellowing of the eyes or skin. If you experience any of these symptoms, it's important to contact your doctor right away. Bedaquiline can also cause a rash, so it's important to inform your doctor if you develop any rash while taking this medication. While a serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, it's important to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. This medication is typically used when other treatments have not been successful. It's important to note that bedaquiline has the potential to increase the risk of death and may affect the rhythm of the heart. This risk may be higher if you are also taking other medications that can cause changes in heart rhythm. Be sure to discuss all of your current medications with your doctor to ensure your safety. Before taking bedaquiline, make sure to inform your doctor or pharmacist about any allergies you may have. It's important to discuss any inactive ingredients in the product that could potentially cause allergic reactions or other issues. It's crucial to share your medical history with your doctor or pharmacist before using this medication, especially if you have a history of liver disease. Bedaquiline may lead to a heart rhythm condition known as QT prolongation, which can cause serious symptoms that require immediate medical attention. The risk of QT prolongation may be higher if you have certain medical conditions or are taking other medications that could also cause QT prolongation. Low levels of potassium or magnesium in the blood could further increase the risk of QT prolongation, especially if you are taking certain medications or experiencing conditions like severe sweating, diarrhea, or vomiting. It's important to consult your doctor about using bedaquiline safely. While using this medication, it's best to avoid consuming alcoholic beverages, as alcohol may increase the risk of liver disease. Bedaquiline may also affect the effectiveness of live bacterial vaccines, so be sure to inform your healthcare professional before receiving any immunizations or vaccinations. Older adults may be more sensitive to the side effects of this drug, especially QT prolongation. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor. This medication can pass into breast milk and may have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding while using Bedaquiline. When taking Bedaquiline tablets, it's important to be aware of potential drug interactions that could affect how the medication works in your body. This can increase your risk for serious side effects. It's recommended to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. It's important to note that other medications can affect the removal of Bedaquiline from your body, which may in turn affect how Bedaquiline works. Examples of such medications include efavirenz, rifamycins, such as rifampin, rifapentine, and others. It's important to discuss with your doctor or pharmacist if you are taking any of these medications while using Bedaquiline. Remember, it's always best to follow the advice of your healthcare provider when it comes to managing your medications. If someone has taken too much Bedaquiline tablet and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help. You can call 911 for emergency assistance or contact a poison control center for guidance. U.S. residents can reach out to their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. This medication is prescribed specifically for your current condition, and should not be shared with others or used later for a different infection unless directed by your doctor. Before starting this medication and while you are taking it, your doctor may require lab and/or medical tests such as liver function, EKG, and monitoring of potassium/calcium/magnesium levels. It is important to keep all medical and lab appointments and consult your doctor for more details. If you happen to miss a daily dose within the first 2 weeks of treatment, simply skip the missed dose and take your next one at the regular time. However, if you miss a dose from week 3 onward, take it as soon as you remember, then resume your usual 3 times a week dosing schedule. It's important to ensure there is at least 24 hours between your doses and not to exceed the weekly dose in a 7-day period. If you're unsure about what to do after missing a dose, it's best to consult with your doctor or pharmacist. When storing Bedaquiline tablet, it's important to keep it at room temperature, away from light and moisture. Make sure to store the 20 mg tablets in the original container and keep the desiccant in the bottle, closing it tightly after each use to protect from moisture. As for the 100 mg tablets, they should also be stored in the original container, and if necessary, can be transferred to another container for up to 3 months. Make sure to close the bottle tightly after each use to protect from light. It's important to keep all medications away from children and pets, and to not flush them down the toilet or pour them into a drain unless instructed to do so. When the product is expired or no longer needed, be sure to properly discard it by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.